Okay. All right. So I am Dr. Solorzano. I am an audiologist with Hearing Partners. And today we're going to be talking about how hearing loss affects your brain. So this is the first part of our Zoom series. And I will be going through our presentation. And at the end, I will hold some time for any questions you might have. So first, I'm going to share my screen so you can see the presentation and follow along. All right.
Yes, I can see that.
Perfect. All right. So now that we'll get started. Okay. All right. So today we're going to start talking about cognition, aging, and hearing loss. So some facts about cognition and aging. Age-related mental decline appears to be due to connections in the brain being altered over time. So this widespread mental decline is experienced usually by the age of 75, although some of the effects of this can be seen earlier on. And research has been interested in the variables that contribute to mental decline, such as why some people can maintain cognition much longer than others, and what are the factors that separate those groups. So when it comes to hearing loss and aging, here are some facts. So hearing loss is the third most prevalent chronic health condition facing older adults today. And this is following hypertension and arthritis. 1 in 3 people between the ages of 65 and 74 will experience some degree of hearing loss. And half of people older than 75 have hearing difficulties. Now, hearing loss has different degrees, which also can impact how people are impacted by it and when they seek help. So another tidbit not listed here on our slide is that on average, it takes someone about 7 years to seek help for their hearing loss. So that's 7 years of not hearing the world at normal hearing level, if not more. Okay, give me one moment. There's more people coming into the room. I'm allowing them to come in. Okay. And welcome anyone that just recently joined. Just waiting for everyone to get situated. Okay. All right, so we just started our presentation. We're talking about aging, hearing loss, and cognition. And I'll hold any questions for the end, and I'll also be happy to review anything that anyone missed if they joined a little bit later. Okay. All right, so we're talking about hearing loss first. So a little bit more information on hearing loss. And some of this may sound familiar to you if you've had your hearing tested recently or at any point. These are some of the things that your audiologist likely reviewed with you during that test. So we know that there's different types of hearing loss. There's 3 types that we work with. So conductive hearing loss occurs in the outer and middle ear. So this can occur when something fills the outer or middle ear, such as, for example, wax in the outer ear, if you have a plug of wax, or fluid in the middle ear, such as an ear infection or something like that. And when these things do not allow the sound to go through the hearing system, we call that a conductive hearing loss. And usually this kind of hearing loss tends to be treated by medical interventions, such as antibiotic or surgery, or if it's wax, we just remove it. The other type of hearing loss, which is the one that we're going to be talking more about today, it's sensory neural hearing loss. And sensory neural hearing loss occurs in the hearing organ. This is the cochlea. And it is the most common type of hearing loss. It's usually progressive in nature. And currently, there's no cure for it. There's only treatment options. And mixed hearing loss is when you happen to have both, a sensory neural and a conductive hearing loss. So for example, if you already have a sensory neural hearing loss, and then you get a plug of wax in your ears and you're not hearing as well as you were before, that would be considered a mixed hearing loss. There are also different degrees of hearing loss. And as you can see on this graph here, this kind of shows you a little bit of what we as audiologists look at when we test your hearing. So on the graph, we have normal hearing at the top, then we go from normal to mild to moderate to severe, and then at the bottom, profound. And this is how we map out the right ear, which is shown in red on this graph, the left ear, which is shown in blue. And then we see that throughout the different tones that we test, there can be different degrees of hearing loss. So someone might have really good hearing in their low tones and perceive that they can hear well, but then they have a hearing loss in their high-pitched tones. And then that's when people start to say, everyone's mumbling, or I can hear, but I just can't understand everything. Usually that means that you have a high frequency hearing loss and that your brain is not receiving the full signal, and it has to really guess at what some of the words that are being said are. And the hearing loss that we will be talking about today the most is presbycusis, which is age-related hearing loss. And it tends to be, for the most part, look a little like this on this graph, from good low tone hearing and then a sloping down of a hearing loss into the highest tones, having the most severe hearing loss. Okay. And so this is a picture that shows what happens inside of the hearing organ, the cochlea, when there is a sensory neural hearing loss. So the little hair cells inside of the cochlea that are shown in this picture are responsible for transmitting the sound that comes in through the outer ear and into the middle ear. And then it goes into the cochlea, and it's responsible for transmitting those sounds into your brain. So what happens over time, due to different things like exposure to different medications, exposure to loud noises, or even the aging process alone, these little hair cells start to become damaged. And so you can see in the picture on the top, the hair cells are all standing up in rows the way they're supposed to, and they're able to then carry the sound down. But then through damage, this picture on the bottom shows that when there is damage, the little hair cells are not able to do that. So then there's parts of the cochlea that will have this damage that correspond to certain frequencies or certain tones. So if someone has a high frequency hearing loss, the part of the cochlea that's responsible for those high tones will likely look like this. And the interesting part is that the brain is actually also organized in a similar way when it comes to hearing. There's a specific area of the brain in the temporal lobe that is responsible for hearing. And that specific area also has little areas that are assigned for the tones that we hear. So not only is the cochlea organized kind of like a piano, responsible for the low, the mid, and the high-pitched tones, but the brain part responsible for hearing is also organized that way. So that means when someone has really good low-tone hearing, then their brain is receiving that input into the low tones very well. But if they have the high frequency hearing loss, that high frequency hearing loss, then their brain is also lacking stimulation in that specific area. And so this is all going to come in handy to know now when we start talking a little bit more about how hearing loss affects the brain. Okay, so now we're going to look at some of the research on hearing loss and dementia. So hearing loss in midlife has been estimated to account for 9% of cases of dementia. And this is kind of huge, a huge disease burden, considering that dementia can affect 47 million people worldwide. So 9% doesn't sound like a big number, but it actually is. So hearing loss is most commonly caused by cochlear damage, as we talked about those little hair cells being damaged inside the cochlea. And dementia is due to cortical degeneration. So dementia tends to happen in the brain, and that usually begins in multimodal cortex. Okay, so research is really interested in how these two things are linked. We also know that the degree of hearing loss is correlated with the risk of dementia. So for a mild hearing loss versus a moderate, versus a severe or profound, you are at higher risk for dementia the higher up you go into your hearing loss. So why are hearing loss and dementia linked? And that's kind of what we really want to know. And I'll give you some of the research about this. So research suggests that there are multiple biological and psychological pathways that can link these two together. And the first one that we're going to talk about is hearing loss and brain atrophy. So a growing body of evidence has shown that a relationship between age-related hearing loss, or presbycusis, and structural brain changes exist. These studies have used MRI technology to study the brain structures and changes over time in people with and in people without hearing loss. And the interesting part is that research has suggested that high-frequency hearing loss is associated with a disproportional temporal lobe atrophy. So that lobe that's responsible for hearing and processing hearing tends to atrophy over time when there is hearing loss, as well as generalized whole brain atrophy. So hearing loss is not only affecting the temporal lobe, but it's also affecting the entire brain. So the other thing is that they also have found to have more atrophy in people with hearing loss than in people without hearing loss over time. And studies have suggested that the hearing loss itself may contribute to a faster rate of atrophy in the brain. So now let's talk a little bit about another reason why hearing loss affects the brain. So it's hearing loss and cognitive stimulation. So research has suggested that this is another link between hearing loss and cognitive decline, and is that hearing loss can lead to a decrease in stimulation of cognitive processing. So if you're not receiving the full signal to the brain because the ears are not providing that signal to the brain, then your brain is actually not being fully stimulated with that signal. The idea is that auditory deprivation, or not having that access to the full signal, creates a distorted listening environment, particularly one with speech and language diminishment. So when you're at a restaurant and people around you are talking and you're hearing some of the words, or you're processing some of the words, but not catching all of them, that is already a diminishment of the signal that is available to you in that area. If you have hearing loss, your ears are not providing the brain with everything that it should. And that is partly what is contributing to the brain then not being able to process the full speech. So this change in brain structure and function that we know can happen from this hearing loss, or this not having that full signal, is a risk factor for that subsequent development of dementia. So experiencing these difficulties, can also make someone retreat from environments where speech is degraded. So this can make someone over time, if you are always in a setting, in a restaurant, for example, where you feel like you're not getting the full signal and you really have to lean into conversations, or you feel like the jokes are being told, but you're not catching them. Over time, this may make someone with hearing loss retreat from those environments, which then means that they are more socially isolated. And social isolation is a big risk factor for dementia as well. You're not getting that stimulation of the speech and the noise and all of those things that our brain needs to continue to be active. So this is another risk factor for cognitive decline. Okay. So now we touched briefly on hearing being processed in the same brain lobe that is responsible for encoding memory. So the temporal lobe is not only responsible for hearing, but also memory encoding happens there. And hearing loss can be associated with memory in other ways. Not only do we know that it's affecting the brain to have hearing loss, and that it can be affecting the entire brain as far as atrophy, especially in that lobe that it's responsible for hearing. But now we also know that hearing loss can affect memory in other ways. So people with hearing impairments or hearing loss use greater cognitive resources just for listening. And doing so makes these resources not available for other aspects of cognition. So by resources, we refer to things like attention, working memory, and language processing. So the bottom line is, if the ears are not providing the sound to the brain is then preoccupied with filling in those gaps, which can lead to an inability to remember information that you're listening to. So for example, if someone is giving you a phone number and your brain is mixing up some of the sounds, so the difference between 50 and 60, that's a high frequency hearing loss clarity issue that someone may have to really work towards getting the difference between those sounds. So if your brain is working on focusing on lip reading, focusing on making sure you heard the actual number, you're less likely to remember any of those numbers, and you're less likely to be able to use your memory in that instance, where your memory is what should be used by your brain in order to maintain activity. So that's another way that hearing loss can affect memory in different scenarios and different settings, when it takes over the cognitive load because the ears are not providing the brain with that ease of listening that it needs. Okay, so we reviewed a lot of different information on what can, let me just see here. It's a good question. Okay. And yes, feel free to type any questions in the chat box and we'll review those at the end as well. All right, so I gave you a lot of information on how hearing loss can affect the brain. And it sounds very doom and gloom, but there's actually a lot of things that can be done to prevent this and to help it. So I'm going to review some of the things that are recommended. And if you have any other suggestions, you can also, or things that you've heard from different doctors, we can talk about those as well. Okay. All right. So treatment options for hearing loss specifically. The first step is to receive a hearing test from an audiologist and to discuss not only the hearing loss, which type you have, which degree you have, how it's affecting your everyday life and how it can affect your brain, but then also discuss the treatment options for that. Your audiologist will be able to recommend the appropriate treatment for you. And this treatment can range really from, hearing aids to cochlear implants to other kind of devices to hear better. At the end of the day, the overall goal is that the ears are able to provide the brain with the stimulation that it needs. And the only way to do that, if the ears are not functioning well, is to use a device to do it for them. So the treatment option chosen will allow your brain to start to rehabilitate to the sounds that the ears have not been providing for however long. Remember, we said that it can take up to 7 years to do something about a hearing loss. So that's 7 years of the brain not receiving that stimulation. So as audiologists, we then work with you to rehabilitate the brain. Same thing if you had an arm cast for however long you had it. When you get that cast taken off, you don't have normal function right away. It takes time for that muscle to remember how to act, how to move. And it takes a rehabilitation process. And that's what we do as audiologists with you, with the use of hearing aids or whichever treatment option is right for you. We help you rehabilitate your brain. So there's also interventions for cognitive decline in general, and you may get some of this information from your general doctor or neurologist or anyone else that you see regarding cognition. So some of the cognitive interventions that are popular right now and that research has shown to be preventative against cognitive decline are first physical activities. So there's been a lot of research that shows that higher levels of physical activities are linked with a reduction of cognitive decline. So maintaining that activity as you age is very important. high social engagement is very big in preventing cognitive decline. And this is one of those things that people with hearing loss tend to kind of retreat from, because it's difficult to be in those environments if you can't enjoy the conversation naturally, if you have to really struggle to hear every word, and if you feel that you're missing the jokes or whatever people are sharing, it's really easy to then start to retreat slowly over time from those environments. But we know through research that social engagement is crucial to being able to maintain cognition. And then there's other examples of leisure activities, such as puzzles. Doing a daily puzzle can help. Reading, all of those things that have been shown before to help prevent cognitive decline are still kind of gold standard for that. Okay. All right, so now we've come to the end of our presentation, and I've given you some of the information on the latest research for how hearing loss affects the brain. We talked a little bit about how age-related hearing loss specifically has an effect on the brain, mostly because the high-frequency hearing loss that happens with age-related hearing loss is something that makes people think that they're still hearing well, because they're still hearing those low tones very well. They hear volume okay. It's not until other people start to tell them, go get your hearing checked, something's not right, that people with that high frequency hearing loss tend to think that they're hearing perfectly fine. Everyone else is just mumbling. But the reality is that it's kind of a sneaky type of hearing loss. And it's because of that, it's a little more dangerous towards this brain activity that we're talking about, because it makes you think that you're doing okay when you're not. And you don't know what you're missing until then we give it back to you through whichever treatment is appropriate. And you realize, wow, I can't believe I hadn't been hearing that for however long. Which, if you hadn't been hearing it, that means your brain was also not hearing it. All right. So now I'm gonna stop sharing my screen so we can go to the chat, see if anyone has any questions. Okay, let's see. So someone asked, are there any exercises that are better than others to stimulate the brain regarding hearing? And that's definitely a very good question. So we know that overall, stimulating the brain can help. So puzzles or physical activities, education in general, taking a class, picking up a hobby, all of those things are good for cognition. When it comes to hearing, it's the same idea. So helping the brain get stimulated through hearing or audition can help that cognition stay active in that area responsible for hearing. So first of all, you have to have a treatment. You have to be able to have the access to sound. The only way to do that when you have hearing loss is through treatment, hearing aids, cochlear implants, whatever it is that's appropriate for your hearing loss. Once you have the right treatment and the brain is then receiving the sounds that it was missing before, then you can work on things like stimulating the brain by using certain things. Like, for example, reading out loud to yourself if you don't have anyone to read to you. Listen to books on tape. That usually will help stimulate the brain, because you won't have necessarily a visual cue. You'll be forcing the brain to just focus on hearing. And your audiologist can help you also dictate what may be a good plan for you as far as getting your brain rehabilitated once you start wearing hearing aids. There's different apps that you can use, and there's different programs that you can use on your computer as well that can also help you with that cognition when it comes to hearing loss. And we have a list of them. We can go through them with you and see what would be appropriate for you once we know that you are getting the right sound quality into your ears and into the brain. Okay, are there any other questions? Okay, so if after reviewing this information, you come up with any questions, or maybe it's been over a year that you've had your hearing tested, it would be a good idea to make an appointment, have a new hearing test, and bring these questions up with your audiologist. We are more than happy to show you the progression of your hearing loss. If we've been testing you every year, we can see, you know, we started here and now we're here. We can talk about different treatment options. If you're already wearing hearing aids, that's great. Then we can talk a little bit more about other programs that you can be using to continue to rehabilitate the brain and continue to make sure that you're getting full access to sound around you. And like I said, if you have any questions, I'm more than happy to answer them. You can give us a call. I'm in the Boynton Beach office. You can come see me, have a hearing test, or just give me a call and I'll be happy to answer questions. Don't miss our next Zoom series. It'll be in February. You're going to receive another email. And now make sure that you go through your spam and junk folders because sometimes they go in there. But that other email will have the information to join us in February, where we're going to be talking about heart health and hearing loss. Okay. Thank you all for joining me today. It was a pleasure, and I hope you have a good rest of your days.